The first tests to perform are the elbow range of motion tests. The first is active motion, in which the athlete attempts to perform elbow flexion or extension on their own. Next is passive motion. For this, the evaluator will perform the movements for the athlete. The last range of motion test is resistive. The evaluator will perform an elbow movement and the athlete will attempt to resist this motion. If the athlete fails either of the first two tests because of an inability or pain with movement, the resistive range of motion test is skipped. The next tests to perform are the valgus and varus stress tests. We will start with the valgus stress test. You will stand laterally to the elbow being tested and have the athlete's elbow flexed 15 to 25 degrees. One hand will support the elbow with fingers behind the joint to palpate the medial joint line. Your other hand will hold distal to the forearm. Apply valgus force to the joint and feel for any laxity of the ulnar collateral ligament. For the varus stress test, you will stand medial to the injured elbow while the athlete is in the same position as the valgus stress test. One hand will support the elbow with fingers behind the joint to palpate the lateral joint line. Next, apply varus force to the elbow and feel for laxity of the radial collateral ligament.